Welcome back to the Humble Healer podcast with Dr. Quang Le, family medicine physician. And today I will continue with the series about weight loss strategies. And in the previous episode, I talked about the problem with obesity epidemic in America. And the second episode was about non-medication strategies to help with weight loss, including lifestyle changes, which is essential in any weight loss strategy. And today we'll talk about medical and surgical management of weight loss. So there are rules for um, all these treatments, and uh, it is important to know whether um, you are a candidate for each treatment. And I always favor the lifestyle changes because that is important for not only weight loss, but your overall health. And that's always something that I recommend first, and also something that I would recommend to combine with medication and surgery. Because without lifestyle changes that are long term, most weight loss strategies will fail. Even the surgical patients, which we have seen, and I have seen many times, patients find ways to work around the surgical changes that were made to help them curb their appetite, but they do find a way around that to satisfy their cravings. So relying on medication and strategies and surgical treatment exclusively will reduce your long-term success guarantee. But there are ways that you could use them to give you a good head start, because I know many patients have tried unsuccessfully, even with maximal effort, working out in the gym for 2 hours and lifestyle changes. A lot of time it is helpful to start on a medication that give you a bit of a head start and boost your morale and makes it easier for you to reach your goal. And then you can continue with your lifestyle changes in order to maintain that goal. And eventually the lifestyle changes will allow you to get off the medication. And one important thing to know about these medications, I mean, they all have side effects and adverse effects. So it's also important to know what is contraindicated for each of these medications before starting them. And I've been doing obesity medicine for 10 years, over 10 years, and I do see which medication are safer or more tolerable for patients. And so it's important to be aware of the pros and cons for all these medication and surgical treatment. The important things that I recommend for patients with the recent GLP-1, Ozempic, Wegovy, Mounjaro, Zepbound, is that same message is that do not rely exclusively on the medication to help you lose weight, because if you do, once you go back down on a dose or get off it, the cravings, the food noises will come right back. So make sure that you let the medication train you. For example, if you go out for dinner and you used to eat a big serving, a big portion, and after starting the medication, your portion came down significantly. For some of my patients, down to a third or half of what they used to eat for dinner. You have to find a way to maintain that in order to maintain success. And that way, when you get off of medication, you'll be able to have the same eating habit as when you are on the medication. So that's the key. And also, part of a lifestyle change is also to incorporate exercises into your routine, because when you lose weight, you also lose both fat and lean body mass, such as muscle and bone mass. So it does increase the risk of having osteoporosis. So I actually talked to a patient yesterday who lost 30 pounds on Zepbound, and he complained that he's been weaker because he lost muscle mass and couldn't lift the same amount of weight as he used to. And it is important to incorporate exercise, including weight-based exercise, in order to regain those lean body mass. And the end result will be a net loss of the fat body mass and the body fat percentage when you incorporate exercise into these weight loss methods, which across the board will cause weight loss in all body composition. And also, if you want to stay as strong as you used to be before the weight loss, then you need to do weight-based exercise. And so that's very important when you have weight loss strategy. So let's start with talking about the medications here. The first one is the GLP-1 medications, and there are two kinds. The Wegovy and Ozempic act on the GLP-1 receptors, and the other, the Zepbound and Mounjaro, worked on both GLP-1 and GIP-1 receptors. You don't have to memorize those. Just know that the second class of medications are more effective because they work on two different receptors versus just one for the Ozempic and Wegovy or semaglutide. The most important barrier for this medication is the cost, and there may be changes happening allowing Medicare patients to get this medication for cheap. But I think that private insurance holders still encounter a problem with getting this medication approved unless they have a lot of comorbidities, including diabetes, cardiovascular risk factors. And then there are online website too that you can get the compound version, like Hims and Hers and other websites that you can get them for maybe a few $100s only, $200 to $300 per month. Millions of Americans have been using these websites also to save the money. My overall experience is that these don't work as well as the brand names, but it does still work. You just have to use higher dose. And for these injections, if you have history of medullary thyroid cancer, a particular thyroid cancer, there are four kinds, but this particular kind is a contraindication. Or if you have a recent surgery within 1 week of operation, there may be increased risk of blood clots, so you should hold this medication if there is a surgery coming up. Other than that, pancreatitis or patient at risk for having acute pancreatitis or patient with pancreatic insufficiency, then they should not take this medication because they can increase the risk of having pancreatitis. So if you take these medications, should beware that they can cause constipation, they can cause nausea, which in a way curb your cravings quite effectively, but sometimes can be more severe to the point that you need some nausea medication, can cause malaise. And a lot of my patients reported that hydrating aggressively is very helpful with helping with malaise as well as constipation. Sometimes patients have severe GI symptoms like nausea, vomiting, and you can go to the emergency department or your primary care office or urgent care where a place like I work, we can check to make sure you do not have pancreatitis. And I've only have encountered one pancreatitis case out of several patients that came in for having GI symptoms from GLP-1, and it was not severe. So overall, it's very safe and very effective. Consult with your um, primary care team and to see whether you're a candidate for treatment. If patients do not like injections once a week, then they do have a new oral version of these medications, but because they are new, they are still very expensive and rarely approved by insurance companies. So what are other form of medications? One popular medication is phentermine, which I like because when you take the medication, you do not need to monitor lab work, and it has a safety record for over 50 years. And so you just need to monitor your blood pressure and heart rate. And for those patients that take ADHD medication like methylphenidate or Ritalin and Adderall, it's not a good idea to combine with phentermine because they both can cause elevation of blood pressure and heart rate and increasing the risk of cardiovascular disease, health outcome, or health effects. So I don't generally prescribe phentermine with these medications. And phentermine also has been known to improve concentration among patients. So it can use as a replacement for these medication. Doesn't work as well, but it helps you lose weight and does improve your concentration a bit. And other medication like topiramate, again, one of the things about these medications, if you're pregnant, obviously it's contraindication, but each of them has their own separate contraindication. Topiramate has an additional issue with causing birth defects. Again, if you don't take it with pregnancy, then that's not an issue. But you have to be monitored also to make sure that you're not pregnant with unknowingly while taking it. And topiramate may cause, in rare cases, tubular acidosis (RTA). Kidney function need to be monitored, and that's why if you want to take these medications, that's every 3 months, kidney function should be checked to ensure that this is not developing. And bupropion is another medication, and that also have antidepressant effect as well as improving your libido, but it does lower your seizure threshold. So if there is history of epilepsy or if you're on another medication that already increase risk of seizure, then this may not be a good choice for weight loss. But if there's no seizure risk and you also have concurrent depression, then this is a really good candidate for weight loss, as well as helping with cravings for smoking. So that's another positive effects from this medication. Sometimes they combine topiramate with phenamine, and I think that there is a generic formula for this. So you can certainly combine, again, with topiramate. It need to be monitored with kidney function every 3 months. I will put a list of these medication up for you to check out on this podcast. The other combination is naltrexone and bupropion. So naltrexone, if somebody is taking opiates chronically, then that's not a good that's a contraindication. It's also used for patients that have opioid use disorder or alcohol use disorder. So it does help with that also. And sometimes you can see a formulary combining naltrexone with bupropion, and the combination will have mental health effect as well as substance use disorders as well as weight loss. The other options are the orlistat. Orlistat essentially inhibits or reduce the absorption of fat in your gut. So what it does is it keep the fat inside the gut and let you poop it out. The problem is that can cause bloating and cramping sensation, not comfortable for patients. That's just something that patients should know when they start taking these medications. And for those patients that do not have high fat consumption, that may be not as effective. So one of the lower line of treatment for obesity that we use, but that's something that due to the uncomfortable GI side effect with the cramping and bloating sensations, it's not optional and reserved for patients that are not candidate for the other options of weight loss. And let's talk briefly about the surgical treatment. I will post a diagram of what essentially the surgeries accomplish to help patients lose weight. The most common method now is gastric sleeve, in which they just staple big a small portion of the stomach, and there's no anastomosis, meaning that reconnecting of any bowel or stomach, so less complication than the other method, which is the Roux-en-Y method, the gastric bypass. And gastric sleeve is not as effective as Roux-en-Y, but it's still very effective with weight loss. And since less complication has been more popular choices among patients and surgeons. So essentially these surgeries aim to reduce the size of the stomach so that the patient's portion will be forced to reduce, since if you eat more than what your stomach can accommodate, then you get bloated and nausea and very uncomfortable feeling. So you're forced to cut down on your portion. And also after surgery, you have to go through post surgery diet with mostly liquid. Then the Roux-en-Y involve also stapling part of the stomach, give you a very small portion of the stomach remained, and then connect part of the small bowel to the distal part of the other small bowel. So there is some anastomosis. So you have to worry about the leakage when the anastomosis or the rehooking or connecting of the bowel and the stomach. The bowel and the stomach is not perfect. So that's a potential complication, and it does work better with weight loss. And you have to also monitor for nutritional deficiency since your stomach size has gone down quite a bit. You'll be at risk for iron deficiency, calcium absorption, and B12. So you have to monitor for those vitamin deficiency and iron deficiency, and you have to take supplement. So everything comes with its up and down side. Nothing, no one size fits all. But in some patients, especially the severely obese patients, these surgery have been life altering, helping them shed 200 pounds, 300 pounds is insane amount of weight. So they do have a role in those patients. So the bottom line is that whatever method you use for weight loss, medication, and surgeries, it is important to incorporate lifestyle changes to help maintain these weight loss and provide that long-term success. And the added benefit is that lifestyle changes will improve your overall health on top of the weight loss. And we talk about activation, the rest and digest system, as I talked about in the past, to help improve health outcome, happiness, resilience, and longevity. This is the same message, basically using the same positive, healthy lifestyle changes to help with weight loss. But that is part of a big picture of improving your overall health is to eat better, be active, dedication daily to your self wellness. It's all the same message here. So you do that every day. I guarantee you, not only you will lose weight, but you live longer, you become happier and healthier, and less likely to get sick or be in pain. Um, so leave me feedback. Let me know what have worked for you and what have not. Any questions, please subscribe to the channel, hit the like button, and hit the bell notification. And I hope you find this episode helpful regarding weight loss and obesity management, and share it with your friends and family. Take care.